Hi, my name is Dr. Ted Lain. I am a board certified dermatologist practicing in Austin, Texas. I'm also a clinical trialist, and I was lucky enough to be involved in the phase 3 program for Deuruxolitinib, as well as the open label and then long term extension for this drug. In fact, we just finished up the 5-year long term extension where we had a few patients at least. So I've been able to follow some patients on Leqselvi now for 5+ years. And so I've got quite a bit of experience with it. And I think what struck me was the fact that all of the patients that I had in the long-term extension maintained their hair growth that they achieved earlier on. So we didn't see a loss of effect in any of the patients, which is really important, right? The last thing these patients want is to start losing hair after they've had full regrowth. And I did not experience that in the patients I had in the clinical trial. In fact, the patients were very satisfied. The other thing that was noticeable over the 5 years is I just didn't see many safety issues in my patients. It seemed to be tolerated quite well. Remember that most of the patients with alopecia areata, especially in clinical trials, are younger and healthier. And I think my patients would fit that mold as well. And really, most patients did very, very well. If you look at the clinical trial data from Thrive AA1, we see the safety profile as being hugely beneficial for Leqselvi. I think the highest number was acne at about 8%. So again, great to see kind of very long durability of results with the 5-year program. Great to see that there were no new AEs that I saw pop up over the long-term extension over those 5 years. So exactly why you'd want to do that trial, to look for any kind of AEs that may be associated with longer term exposure to the drug. And we just didn't see any in our patients at all. That made me think, in what kind of patient would I use this drug? And certainly to meet criteria, the patient would have to have at least a SALT 50, which is 50% or greater hair loss. In the clinical trial, the majority of patients were actually SALT 95 or worse. So it's always a kind of a more severe patient population in a clinical trial than what we see in our practice. And if you see about 30% of those patients, right, they're over half of the patients in the clinical trial were really severe, 95% or worse. And 30% of the total trial population achieved a SALT 20. That tells you that, my goodness, if the average patient coming in, which would probably be able to get Leqselvi, is most likely not the alopecia totalis or universalis patient, but someone between 50 and 100%. I feel really good about the opportunity for hair regrowth in those patients, knowing that, especially at week 24, it's a early time point, and we would expect continued improvement over time. The other thing to think about is in that Thrive AA1 trial, we saw a linear progression in terms of their response over time. It's unusual for a JAK inhibitor to cause such a reliable regrowth of hair. JAK inhibitors in particular people tend to have their own kind of timeline of response, whereas some people respond early, others respond very late. We know that the one variable that may be related to time to response is severity, where the patients who are between 95 and 100 tend to respond slower and maybe not as completely as those with between 50 and 95. What we saw in this trial, especially in the Thrive AA1, is that there was early onset of hair regrowth that continued to improve over time, with the slope that, at least at week 24, didn't look like it was plateauing. And I think I can tell you from my experience in the 5-year program that we continue to see improvement and then maintenance of that full hair regrowth with those patients. Safety-wise, as I mentioned, very beneficial as well. Leqselvi is approved for 12 years of age and older. And so it was approved from that age, at that age group, from the very beginning. So we know that there's safety data down to 12 years of age. So any of your adolescents who have that kind of hair loss would benefit most likely from Leqselvi. We do have to do some SIP testing in order to make sure the patient qualifies for Leqselvi, and that's done through, I believe it's LabCorp and Quest are the two labs that are currently available for SIP testing. And remember that lab cost is covered by the manufacturer of Leqselvi. So yes, it's a pain to get lab work, but again, they do not have to bear the cost. Otherwise, in terms of lab values, there was nothing that was really worrisome or concerning about the phase 3 trial. We saw some patients, I think it was 5 or 6% with an increase in CPK. But again, you see that with all other JAK inhibitors as well. I just make sure that patients take the drug with a full glass of water, maybe with food, but not immediately after exercising. I noticed that that can increase CPK quite a bit if you take a JAK inhibitor right after exercising. Certainly, the elevations in CPK were not to the level of concerning for rhabdo. But again, rhabdo is more of a clinical diagnosis than it is a lab diagnosis. So you'd have to ask patients about muscle pain or cramping. Other lab value abnormalities were slight increases in HDL and platelets, I believe. Again, nothing too concerning. Regarding the boxed warning, which of course all JAK inhibitors have, at least in the phase 3 program, there was there were no cases in the 8 milligrams twice daily of emboli or thrombosis, no cases of malignancy or cardiovascular events. So patients tend to do very, very well. Remember that the improvement in eyebrow and eyelashes is extremely important to patients. In fact, I found that in my trial patients across different alopecia areata trials, the improvement in brow and lash was actually much more important than improvement in scalp. And so I almost wonder if that should be the primary endpoint. Just because the scalp, they can wear a wig or a hat, but with the brows and lashes, it's much more difficult to improve those. And so we were able to see brow and lash improvement in both the shorter and long-term trials with Deuruxolitinib. And again, that meets patients' needs in order for them to feel better about themselves. In regards to whether the patients felt like the outcomes met their satisfaction, we did see concordance between improvement in hair growth and patient satisfaction, as you would imagine. So that's what we want as physicians, right? We want to make sure the quality of life for our patients improves, and patient satisfaction of satisfied to very satisfied was well over 50%. So patients did very well there in terms of their improvement in satisfaction. So I hope this helps in regards to what patients to consider Deuruxolitinib for. I think any patient that meets criteria, especially 12 and above, based on the safety and the efficacy data, Deuruxolitinib should absolutely be considered first-line treatment for alopecia areata patients with moderate to severe disease.